Hello, well, I hope you're doing well today. So we are finishing up our textbook content today. This is chapter 13. We're talking about nutritional supplements and ergogenic aids. And today specifically, we are talking about alcohol. Here we go. So evidence suggests the use of substances to enhance performance, including natural stimulants and concoctions, began as early as our ancient Olympic Games. Now, with that, our modern Olympic Games, as early as the 1900s, drug use emerged as a concern with the introduction of synthetic substances. In 1975, anabolic steroids were officially banned in Olympic competition due to their performance-enhancing effects and health risks. Now, the World Anti-Doping Agency, or WADA, provides a comprehensive list of banned substances and methods to ensure fair play and athlete safety. And it's really to protect the integrity of sport as well as athlete health by enforcing anti-doping rules and conducting testing. So drug use has been a part of sports for centuries, evolving with advancements in science and technology. The fight against doping includes stringent regulations and testing to maintain fair competition and athlete well-being. To give an overview of alcohol, the chemical name is ethanol, and it is a psychoactive drug that affects the central nervous system, influencing mood, cognition, and behavior. It can be harmful in excessive amounts, leading to various health issues. It does provide calories as a nutrient, but lacks essential nutrients and can disrupt nutrient absorption and metabolism. There are some negative health implication effects that occur, and you probably are aware of this: impaired cognitive function. Alcohol impairs judgment, coordination, and reaction time, affecting performance and safety, which is one reason you should not drink and drive. There's also a big addiction risk. So regular use can lead to alcohol dependence and addiction. And excessive consumption is linked to liver disease, cardiovascular problems, and increased risk of certain cancers. Now, there are some positive effects in moderate consumption. Some studies suggest that moderate alcohol consumption may have cardiovascular benefits, such as improved heart health due to an increased HDL cholesterol, or the good cholesterol. There are some ergogenic effects as well that impact performance. Now, the short term is that alcohol may offer temporary relaxation or pain relief, but generally impairs physical performance and recovery. Now, the long term chronic alcohol use can lead to a decreased muscle mass, endurance, and overall fitness. So it's important to have a balanced approach. While moderate alcohol consumption may offer some health benefits, its potential negative effects on health and athletic performance make it important to consume with caution. And understanding the impact of alcohol on both health and sport performance is crucial for making informed decisions. So if we look at the alcohol and nutrient content of some typical alcoholic beverages, one specifically with wine, Bordeaux wine, it has an alcoholic content that ranges from about 12 to 14% alcohol by volume, or ABV. As far as nutritional content, we're looking at a 5-ounce serving. That's approximately 125 to 130 kcals, and it has about 3 to 4 grams of carbohydrate. As far as protein or fat, it's negligible. Now, some additional notes to that, it does have some vitamins and minerals. It contains small amounts of certain vitamins and minerals, such as potassium and some B vitamins, but not in significant quantities. Now, it also contains antioxidants like resveratrol and flavonoids, which are found in the skins of the grapes used to make red wine. Now, wine does contain, again, some sugars, mainly from residual sugars, carbohydrates. The caloric content is mainly from alcohol with a smaller contribution from carbohydrates. It does vary depending on the wine type and brand, but generally around 12 grams of alcohol per 4-ounce serving. Now, if we look at a can or a bottle of beer, that's typically 12 ounces. As far as carbohydrates are concerned, in regular beer, there's roughly 13 grams. In light beer, it's about 7 grams, and non-alcoholic is about 12 grams. As far as calories are concerned, regular beer is typically 150 kcals, with light beer being about 109, and then non-alcoholic beer about 55 kcals. And then the alcohol content, regular beer is about 13 grams, while light beer, 11 grams. Non-alcoholic beer is 1 gram. And then 1 shot glass of distilled spirits. This is about 1 1/4 ounces or 37.5 milliliters. Now, as far as carbohydrates, it does not typically have any carbohydrates. It's roughly around 98 kcals, and the alcohol content is about 14 grams. Now, beer does contain carbohydrates and calories, but it varies by type. Regular beer have more calories and carbs compared to light and alcoholic versions, whereas distilled spirits does contain alcohol with minimal carbohydrates. They are calorie dense due to the high alcoholic content. This is just another look at the caloric content of commonly consumed alcoholic beverages. And you can see carbohydrates contribute to the caloric content of beer and wine, while alcoholic content is the primary source of calories in liquor and energy drinks. Now, as far as variability is concerned, non-alcoholic and light beers have fewer calories compared to regular beer and alcoholic energy drinks. Now, the metabolic rate of alcohol clearance in the body, if we start out talking about digestion and absorption in the stomach specifically, absorption is about 20% of alcohol is absorbed directly into the bloodstream through the stomach lining. Now, the small intestine, the remaining 80% is absorbed in the small intestine where it quickly enters the bloodstream. And then alcohol circulates through the blood to the liver for metabolism. And looking at the metabolic pathway, it is similar to fat metabolism. Despite originating from the fermentation of carbohydrates, alcohol is metabolized similarly to fats. If we look at the liver metabolism rate, the liver metabolizes approximately 1/3 ounce or 8 to 10 grams of alcohol per hour. So this rate can vary based on factors such as age, sex, liver, health, and genetic factors. Now, this is a simplified metabolic pathway of ethanol or alcohol in the liver. So some key enzymes that are involved with the breakdown: alcohol dehydrogenase or ADH and aldehyde dehydrogenase, which is ALDH, and microsomal ethanol oxidizing system or MEOS. So the metabolic pathways with alcohol dehydrogenase or ADH, ethanol is converted to acetaldehyde by the enzyme alcohol dehydrogenase or ADH. Acetaldehyde is then converted to acetate by aldehyde dehydrogenase or ALDH. And then acetate is further metabolized to carbon dioxide in water or used in other metabolic processes. Now, in the diagram, you can see the ethanol, it converts to acetaldehyde and then acetate. And the microsomal ethanol oxidizing system or MEOS is an alternate pathway. It's activated when ethanol levels are high or with chronic alcohol consumption. And ethanol is oxidized to acetaldehyde via cytochrome P450 enzymes. and then acetyl is then converted to acetate by ALDH. And so you can see in the diagram the ethanol breaks down into acetaldehyde and then acetate. And the rate of metabolism, the liver metabolizes about 1/3 ounce or 8 to 10 grams of alcohol per hour. The metabolism rates can vary due to genetic factors such as age, sex, and liver health. Now, the primary pathway, the ADH pathway, is the main route for ethanol metabolism in the liver. The amylose pathway becomes more prominent with higher ethanol intake or chronic consumption. Some of the main effects of alcohol is a depressant, and so it primarily acts as a central nervous depressant. The brain receptors, alcohol is believed to bind with the brain receptors, influencing neurotransmitter release. This interaction may lead to the release of dopamine, which is a neurotransmitter associated with pleasure and reward. Now, alcohol may suppress normal inhibitory control centers in the brain, affecting judgment and coordination. Now, the paradoxical stimulant effect is a transitory excitement or initial sensation. So despite its depressant nature, alcohol can produce a paradoxical stimulant effect. Users may experience a temporary sensation of excitement or increased sociability. Now, alcohol primarily, again, it depresses the central nervous system function, affecting brain control and coordination, but there are initial feelings of excitement that may occur, though it is a temporary effect in contrast with the alcohol's overall depressant impact. The effects of alcohol on psychological effects. So there is a suppression of inhibition and a behavioral impact that occurs. Alcohol lowers our social inhibitions, which can lead to more outgoing or risky behavior. There's also an increase in self-confidence or perceived improvement of such. So users may experience a boost in self-confidence and social ease. There's also reduced anxiety, which can be caused by relaxation. So alcohol can produce a calming effect, reducing the feelings of anxiety, and a decreased sensitivity to pain. It has an analgesic effect. So alcohol may lessen pain perception, making it seem less bothersome. And then there are physiological effects. There is a variable effect on the heart rate. So some heart rate changes that occur. Alcohol can cause fluctuations in heart rate, which may vary based on the amount consumed. There's also an increased glucose release, which causes a metabolic impact. And alcohol stimulates glucose release from the liver, affecting blood sugar levels. There's an increased release of fatty acids as well with lipid metabolism. And so alcohol promotes the release of fatty acids into the bloodstream. As far as an energy content, their caloric value associated with alcohol, it does provide a high number of calories, contributing to our overall energy intake. The paradoxical sympathetic effect, it is a sympathetic activation. So despite being a depressant, alcohol can induce a paradoxical sympathetic effect, such as increased heart rate or heightened awareness in certain situations. And so as far as the psychological effects, it can alter behavior, increase self-confidence, and reduce anxiety, as well as decrease pain sensitivity. And then physiological effects, it has a varied impact on heart rate, metabolism, and energy content with some paradoxical effects. Now, alcohol's effect on psychomotor performance. Our psychomotor skills are affected by alcohol, and that's one of the reasons you see DPS pulling people over to have them do a test to check their psychomotor skills. Our reaction time, the speed at which an individual responds to a stimuli, and balance, so maintaining stability and coordination. Our hand-eye coordination is affected, so the ability to use hands and eyes together effectively. as well as our visual perception, the ability to interpret and make sense of visual information. And then anxiety and tremor. There is a reduced anxiety. So alcohol decreases anxiety, which might temporarily improve performance. And in small doses, it may reduce a hand tremor. Now, if we look at the different doses, small versus large doses, small and moderate doses versus large doses, there is a simple reaction time. So less affected if it's in small and moderate doses, simple tasks may remain relatively intact. And as far as complex skills are concerned, they may be adversely affected, such as tasks requiring higher levels of coordination and judgment. Now, in large doses, our overall performance, our psychomotor tasks are adversely affected, including our reaction time, balance, and coordination. So there is a dose-related effect. There are deteriorative effects that increase with higher alcohol consumption. Now, as far as permissibility of alcohol use in sports, there is a historical context. And alcohol use was prohibited for all Olympic athletes up until 1972. The World Anti-Doping Agency, or WADA, of course, regulation, they put together regulations, and there were previous prohibitions where alcohol use was restricted in competition only for specific sports like archery, air sports, automobile sports, powerboating sports, that sort of thing. Now, as far as the doping threshold is concerned, the blood alcohol content, a threshold of 0.10 grams per liter was used to determine doping violations. There have been recent changes where there has been a removal of alcohol from the WADA list. So in 2018, there was an update where alcohol was removed from the WADA prohibited list in 2018. What effect can drinking alcohol have on your health? There are some toxic effects, of course. At the cellular impact, alcohol and its metabolite acetaldehyde can have direct toxic effects on cells. There is also DNA damage, potential damage DNA contributing to cellular dysfunction and disease. There are other adverse health outcomes as well, liver disease. And so that includes fatty liver, alcoholic hepatitis, and cirrhosis, and psychological problems, mental health. It can contribute to depression, anxiety, and cognitive impairment, and cardiovascular disease. That there is an increased risk of hypertension, heart disease, and stroke. As far as cancer is concerned, much of it depends upon the type of cancer. So it is associated with various cancers, including those of the liver, mouth, throat, esophagus, and breast. There are also fetal alcohol spectrum disorders, or FASDs, and basically this affects development of the fetus. It can cause developmental and physical disabilities in offspring when consumed during pregnancy. And obesity. There is weight gain because the alcohol is high in calories and may contribute to weight gain and metabolic issues. And alcohol dependence, addiction. So there is a risk of developing alcohol use disorder or addiction. Alcohol affects all cells in the body with potential for significant health issues. And the health risks are associated with liver disease, psychological issues, cardiovascular problems, cancer, developmental disorders, obesity, and dependence. Now, effects of increasing blood alcohol content, or BAC. BAC in general effects on brain function. Really what you see is drinks that are consumed in 2 hours, there's usually a blood alcohol content of 0.02 to 0.04. So some general effects, you'll have euphoria impaired thinking and reasoning, reduced tension, relaxed feeling, or relief from daily stress. Now, 4 to 5 drinks in 2 hours, and the blood alcohol content looks more like 0.06 to 0.09. And there is greater impairment in thinking and reasoning, impaired perceptual motor responses such as reaction time, and it is considered to be legally drunk in all states at a 0.08 blood alcohol level, impaired judgment, high feeling, impaired fine motor ability, and coordination. Now, 6 to 8 drinks in 2 hours, and you can see your blood alcohol level is typically between 0.11 to 0.16. And there are impaired fine motor coordination, slurred speech, impaired gross motor coordination, and then they'll usually have a staggering gait. Now, 9 to 12 drinks in 2 hours, the blood alcohol level is more like 0.18 to 0.25, and you have significant impaired gross motor coordination as well as impaired vision, such as with double vision, and loss of control of voluntary activity and erratic behavior. 13 to 18 drinks in 2 hours is 0.27 to 0.39 blood alcohol level. And you have, again, impaired alertness, potentially leading to sleep or coma. They're in a stupor and total loss of coordination. Now, anything over 19 drinks in 2 hours, the blood alcohol level is typically 0.40. And here you start to have severe issues like respiratory control issues that lead to respiratory failure, coma, and depression of respiratory centers, and they're at a risk of death. So there are results in an increasing blood alcohol level and a progressive decline in brain function, motor control, ranging from euphoria and impaired reasoning to severe impairment and potentially fatal outcomes. Now, very high blood alcohol levels can lead to life-threatening conditions, including respiratory failure and death. There are some positive effects of light to moderate alcohol consumption. If we look at the epidemiological research findings, light to moderate alcohol consumption is associated with reduced mortality. There are some possible benefits included that improved cardiovascular health and increased longevity. The negative effects of alcohol consumption are increased risk of breast cancer. Even low alcohol consumption can elevate the risk of developing breast cancer. The pregnancy risk. So alcohol should be completely avoided during pregnancy due to the risk of fetal alcohol syndrome disorders. So while there might be some moderate consumption benefits with reduced mortality in some populations, there are increased risk of breast cancer, and really during pregnancy we should avoid absolutely any alcohol at that point in time. Potential benefits of moderate alcohol consumption. Again, most research studies suggest that there is an effect of alcohol on the heart health, and light to moderate intake is associated with reduced risk of coronary heart disease and lower risk of overall cause mortality. There are recommended limits. So men is less than 2 drinks per day. For women, it's less than 1 drink per day. And as far as proposed mechanisms for cardiovascular benefits, really what they look at is lipid metabolism. So alcohol may improve our lipid profiles by increasing high density lipoprotein cholesterol, or HDL. There's also a vascular function, and that there's potential enhancement of endothelial function and improved blood flow, and a stress response. So there's possible reduction in stress-related damage to cardiovascular tissues, as well as insulin sensitivity. There's an improvement in insulin and sensitivity that may contribute to a reduced risk of metabolic syndrome. So Again, there's a positive impact with moderate alcohol consumption that might offer cardiovascular benefits related to improvements in lipid metabolism, vascular function, stress response, and insulin sensitivity. But the full extent and implications of these benefits are not yet completely understood. So balance and moderation are really important. And some key concepts. One drink of alcohol contains roughly 13 to 14 grams of alcohol, or about 1/2 ounce. One drink is typically the equivalent of 12 ounces of beer, 4 ounces of wine, or 1¼ ounces of 40 proof whiskey. However, the alcohol content in some beverages may generally be greater. Alcohol is not an effective ergogenic aid. In fact, it may actually be ergolytic, meaning that it impairs performance. And consumption of alcohol in moderation appears to cause no major health problems for the normal healthy adult and may actually confer some health benefits. However, alcohol may be contraindicated for some, such as women during pregnancy, and the effect of alcohol on breast cancer remains controversial. Heavy drinking is associated with numerous health problems. And that is all that I have for you today. We will continue our conversation in chapter 13 regarding the ergogenic effects of other attributes. I'll talk with you soon. Have a great day.